Substance abuse, particularly alcohol consumption, has been on the rise in Africa for years, according to the World Health Organization. The coronavirus pandemic that resulted in job losses and school closures has now amplified the problem. This children's charity in Soweto says as many as 10 young people contact them daily suffering from addiction.
During the lockdowns, they used to go and drink, and some they were left in the houses alone. The parents are at work, and they start having the house parties and introduced to alcohol, end up into crystal meth, which is very common around here, especially with school children.
While Ikageng monitors the rise of addiction in young people they're helping, national statistics on drug and alcohol abuse are sorely lacking.
We normally get the statistics for COVID, we get the statistics for HIV, but we will never had any statistics for drugs and substance. And I think if we can have that plan, the government can have that plan and then start funding the organizations that are working with drugs and substance so that they fight it as they are fighting for HIV and AIDS, as they are fighting for COVID.
It's not just South Africa lacking data on substance abuse, but the continent as a whole.
We may not count the exact numbers in each and every country. We know we have a problem. We also know that the services are inadequate. That one we know for a fact. Very often the alcohol treatment centers in the government facilities are underfunded. But I think if we were to begin by investing resources into building up the services, then we would be able to collect the data.
She says investing in prevention would also be beneficial and less costly than treating addiction later on. Ikageng's caregivers like Nomali Monoreng look for warning signs among the children they support. She knows them firsthand, having struggled with addiction herself.
Sometimes we need to start with parents. And most of children, you don't know how to talk about their feelings. You don't know how to express. Children need to be taken care in all of your East life, in all areas, like talking, having the conversation, even it's deep, even it's uncomfortable. You need to give the child the chance to talk.
For those looking to get clean, the organization refers them to support groups that help people transition in and out of rehab. They're trying to offer skills training as well, so recoverees can find jobs and a purpose.
Where you find people idling, they don't do nothing with their lives. That's one of those things that causes us, because of the mind is playing around. You started thinking too much, you don't have a job, you don't have anything to do, and then suddenly you see yourself going back to your old ways.
For these youth, getting clean has been the first step, but experts say they'll need opportunities and jobs to give them hope and keep them out of trouble in the long run. Linda Givetash for VOA News, Johannesburg.
Babies born into addiction, those who are searching for